Okay, so conservative care, just to put it in simple terms, conservative care just has to do with every treatment option that a patient would undergo without surgical intervention. So every form of treatment a patient would need that does not require surgery is what we see as conservative care. So for example, when a patient presents with a condition that has to do with, let's give the example of arthritis. If it's not severe, we can try to offer conservative management, so which would include treatment options like physiotherapy, the use of medications, lifestyle modification, and the rest of that. So these are examples of conservative care. So it's non-surgical. Yes, it should actually be personalized based on the patient's medical history. So, of course, it's not every treatment. It's like you cannot offer one type of treatment to everybody. You have to look at the medical history. You have to look at the level of activity. So all these things would determine the intensity of the treatment you want to give. For example, the physio. Some patients may present with pain by the time they start doing physio. So we have to tell them to reduce the intensity of the physio based on their needs. And then some, they might have to increase the intensity. Some may need more sessions per week, and some may need lesser sessions per week. So it actually has to do with the medical history. And then that's what's going to help us modify the plan according to the patient's needs. Yes, so first of all, it is non-surgical, so in other words, it cuts the costs of treatment. The patient tends to save money. That's the first major thing, and I know that everybody will agree with me on that. The second thing is the fact that, of course, if you are able to achieve good state of health without going under the knife, it's a win for whoever it is that's undergoing that kind of treatment. And it actually helps to, like, if one can achieve healing without actually going through any traumatic experience, that actually helps to improve the morale of the patient, right? No risk of infection, no risk of wound breakdown because the person went for surgery and all those kind of things. So it's just a way to let the patient know that everything is not about surgery. You can actually improve if you follow the rules. So if they're able to follow the rules of management as per, okay, make sure you follow your physiotherapist's advice on what you are supposed to do, and then you make it a lifestyle thing. So you modify your lifestyle, and in that way you are able to achieve healing. It's actually a very good thing. You are not going under the knife. So of course, it's one of it's actually it's a good way of achieving healing without being caught. We have things like infrared, the use of infrared, the use of ice and heat treatments, the use of we have these pain ointments and the rest of that, and of course we have the mechanics, range of motion. All these things are within the physiotherapy mode of management. So, but anyway, one can employ some. It's not everything you might need to employ for a certain condition. So for back pain, you can use electrodes, you can use ultrasound, you can use ice, you can use heat, but then it now depends on the presenting condition. For some people with severe back pain, you might not want them to actually go on the treadmill or use the bicycle, the range of motion, because it might just trigger the pain more. So you might want to go with the use of electrodes, infrared, and of course the use of medications as well. These are all conservative treatments. So you might tell them to slow down on the intensity of exercises they are doing, and then focus on other forms that would not place a lot of strain on the muscles. So of course that's where you see the ultrasound coming in, the infrared and all of that. And then for some, you can now tell them, okay, fine, continue your cycling, let's do some exercises to train the muscles and things like that. So it depends on each patient and what they require. So like you are seeing someone, what this one needs is different from what this one needs. Yes, and sometimes they may have the same treatment plan. Many times it may not be the same. It just depends on the intensity of their condition. Okay, injections can be employed for different conditions. For example, when we are talking about back pain again, we have epidural injections that are offered, and you know, it's actually, I would always say that the intensity of the condition would warrant whether or not an injection would work or not. For example, by the time someone who is presenting with back pain comes to the hospital, we ask for an MRI scan, and the MRI shows that the compression is severe. We don't advise injections at that moment. Surgery becomes the next best option, even if it's the last resort. When the patient refuses surgery, then we can bounce back to conservative treatment. We can bounce back to conservative treatment and tell them, okay, fine, we can offer you these treatments, but there is no guarantee that it will work, because we have seen the report, and this is what the report is showing us, and this is the best treatment we are offering you. However, you have a right to say yes or no, so let's try the injections. But then we warn them, this injection may not actually be useful at this point of what the MRI is showing us, but let's help you out since you say you don't want surgery. So you have patients who refuse surgery, but then we can't just leave them like that. We offer conservative treatment. But of course, because it's severe, we are not telling you it's going to work as per 100%, because we already know the stage. But for some people who actually present when the condition is, let's say, mild to moderate, we know that such conservative treatment will work for them. So we offer this as an option to them. So it's the same thing that goes with you know, PRP injections and other forms of treatment. Okay, so again, it goes down to their medical history. So actually, when the patient has been administered this particular treatment, they would report relief, if not immediately, probably 2 to 3 days later. So they would come, you know, by the time they've had the injections, we then advise them to continue physiotherapy, which is definitely another important conservative treatment. So they would report to the hospital for the physio, and we also tell them to let us know if there are any changes that warrant them having to contact us again. So they would, we would usually follow up and ask them questions, and usually they report relief. Anyone who still reports pain will definitely call us back and say, oh, they are still in pain. So usually it's from the patient's experience. So whatever it is they experience, and whatever it is we have seen in their pre-procedure MRI, you know, when we look at the MRI, we can tell that injections will work or not. So we already know that these injections are supposed to work. So if at all they don't work, which is after we've given the patient the injection, they've gone home and they are still complaining of pain, and we ask them, okay, have you started your physio? And they say yes, they've started, but the pain still gets worse, and then that will give us an idea of whether we should try decompressive treatment, which is the surgical, or we just tell them to watch it for a couple of days or weeks. We have a lot of them. I don't even know who to start with. Okay, the most recent one was a patient who presented last week, Saturday, if I'm not mistaken, or 2 weeks ago. So he came with severe back pain. And by the time we saw his MRI scan, there was stenosis, meaning there was pressure on the nerves from the discs that were kind of protruded, but then it created some kind of narrowing. So this actually puts the nerves passing through this area under pressure. So he was offered epidural injection, which he came for on either Tuesday of the following week. And then when I asked the patient like how he was doing, they said the pain has actually gone down. So he just comes for physio to follow up. So this and then there was another patient as well who came with the same issue. After he was given the injection, he reported reduction in pain. We've also had some patients who have come and they don't report reduction in pain. Meanwhile, the surgeon would have already told them the injections we are giving you would not offer any relief. So even if they don't report, we already know that, you know, this thing is not really going to offer them relief. It's simply because the patient will say they don't want to undergo any surgical manipulation. And it's their rights anyway, so we still try to help them, but at the end of the day, we know that the pain would linger. So yes, there are so many stories of people being pain-free after epidural injections. Well, the new advancements, research is always ongoing about, you know, the latest treatments, the latest. Endoscopic surgery is a new advancement in treatment of, you know, of spine issues, or arthroscopic surgery when we are looking at knee or joint issues, and then PRP, you know, all those kinds of things.
Do you think we can classify those minimal invasive as conservative?
Well, yes, minimally invasive procedures are quite conservative in nature. It just means you are not going all in at a particular time. You are just trying to, you know, do something not too extreme in order to save or salvage a situation. Yes. So when we are, you know, there is this particular procedure we call hemiarthroplasty. You know, you are not doing the extreme, so you are just, and usually it's very good for patients who are elderly. You know, and when we are talking about hip conservative surgery, so all these ways of saying, okay, fine, you want to go for conservative management. So usually for people who are younger, you don't want to go all out replacing the hip joints. You want to first conserve it until a particular time where you can now say, okay, fine, you want to do complete hip replacement surgery, because of age. The younger someone is, it now means the amount of years it will take for the patient to now finally come for the major treatment will be earlier for them in their lives. So we tend to conserve by pushing it further, so that by the time they will need it, they would have been well advanced in age. So this is also an example of conservative management.
Thank you very much, Dr. Peter. Really appreciate your time.
Thank you very much.